The title of this side event is Evaluating Health Impacts from Land-Based Pollution, Data Gaps, and Proposed Framework. This side event is organized by the World Bank and the United Nations Institutes for Training and Research, UNITAR, and kindly hosted by the Minamata Secretariat as part of the pre-COP side events. In this opportunity, we have very experienced experts coming to share their experiences and knowledge with you. I would like to explain to you the webinar, how we'll be presenting, how many sections, and how will be distributed the different presentations. The webinar has 3 sessions. Number 1 is the opening remarks. We will start very soon with that. Number 2, the second session is presentations from our experts. And the final session is the discussions and questions and answers. Having said that, I would like to introduce you to Ms. Solvita Clapare, Senior Environmental Economist and Lead of the Chemicals and Waste and Community of Practice of the World Bank. Solvita will start with the opening remarks. Solvita, the floor is yours. Thank you.
Thank you, Jorge. Thanks a lot, for the introduction, and good morning, good afternoon, and good evening, wherever you are joining from the world. Concerns about the health and economic impacts from land-based pollution in low and middle-income countries continue to grow due to the widespread environmental contamination from active and past or so-called legacy operation. The contamination is particularly aggravated by informal activities that are increasingly dispersed throughout communities. However, the overall magnitude and scale of the public health problem arising from these sources remain highly uncertain and poorly characterized, and cannot be compared to land-based pollution in high-income countries due to various reasons such as cultural and regulatory differences. Risk analysis offers a useful framework for evaluating potential environmental health risks across different settings, but requires data and is not clearly linked to actual health outcomes in the community. A more uniform approach is also needed to specifically link observed or predicted exposures and health outcomes in the community to land-based pollution. Informal in nature and using rudimentary technology, artisan and small-scale gold mining, or ASGM, as we call it in the abbreviated version, leads to widespread pollution. The gold mining process releases metals such as mercury, lead, arsenic, and other toxins into air, soil, and water. Artisanal and small-scale gold mining represent one of the largest sources of mercury releases, accounting for 38% of emissions worldwide. The aim of these side events, hence, is to introduce a standardized methodology to evaluate the relationship between environmental contamination, exposure, biomonitoring, and health outcomes related to the contaminants from ASGM, including mercury, methylmercury, lead, and arsenic. It also standardizes the collection of environmental and biological samples and can be used to support local capacity building for conducting environmental assessments. This work has been funded by the World Bank's Multi-Donor Trust Fund for Pollution Management and Environmental Health to promote more systematic and effective responses to deadly and costly pollution. The event will also share some actual experiences from UNITAR and the World Bank related to data gathering and analysis. And without further ado, I'll hand over back to Jorge to introduce our distinguished panel, which will include Drs. Pamela Williams, Trine van Stackelberg, and Eric Negulich. Thank you very much, and looking forward for a successful event today and successful week ahead of us.
Jorge, you're
on mute.
I think you're on mute, Jorge.
Sorry, I'm sorry for that. Yeah, sorry. I said thank you, Solvita, for this very interesting and important introduction to the work we're going to do today. So now we would like to move into the second section of this side event, the experts presentation. So here we will have 3 presentations. Let's invite our first panelist, Mrs. Pamela Williams. She's working with eRig Sciences and the World Bank. Pamela, let me just share the document. Okay. I hope you can see it. Can you see it now?
Yes. Perfect.
Yes. Okay. Yes, Pamela.
Okay, thank you very much. My name is Pamela Williams, and it's a pleasure to be here today to be able to share with you some of our recent work at the World Bank related to evaluating the health impacts of land-based pollution, including mercury pollution in low and middle income countries. And as many of you know, and Solvita just mentioned, this has been a growing area of concern that we believe has received insufficient attention from both a risk evaluation as well as a risk management perspective. And so our efforts and the work that we've done with the World Bank aim not only at trying to raise greater awareness of this important issue, but also on providing recommendations and guidance that we believe will lead to better data collection and better information to support risk-based decision-making in the future. Next slide, please. And so just to clarify, when we're talking about, thank you. When we're talking about land-based pollution in this context, back one slide, please. When we're talking about land-based pollution in this context, we're referring to specific contamination of the environment. This could be the air, water, soil, food, fish, or other media that is a result of some specific industries or activities that are releasing or discharging toxic contaminants into the environment, which ultimately lead to community-wide exposures and health impacts. And some examples of these activities, some of which were just mentioned, include traditional point sources such as lead mines or smelters, as well as more diffuse non-point and more informal sources such as used lead acid battery recycling, small-scale tanneries, and small-scale artisanal and gold mining. And as you know, many of these latter activities often occur in multiple locations instead of a single site within a community, including in people's homes and backyards. And these types of activities can involve exposure to many different types of pollutants. They can involve multiple exposure pathways and an array of health effects, including those from mercury, lead, arsenic, chromium, and other metals and pollutants. Next slide, please. And so we do know from a number of reports and publications, including a database of contaminated sites that has been put together by Pure Earth, that these activities are occurring in low and middle income countries. And in fact, they're growing in number in a number of these countries. But what we don't know, as Solvita mentioned, is what is the magnitude of this public health problem. What types and how much health effects are occurring, and how many people are being affected. And this is the kind of information that we need to do disease burden estimates. And how does this disease burden from this source compare to other sources of environmental pollution, such as ambient or indoor pollution from whether it's vehicles or indoor biomass burning, et cetera. And preliminary data that has been published by Pure Earth and others suggests some very alarming statistics as shown here. And specifically, they have estimated that the disease burden from industrial site pollution across different low and middle income countries is comparable to that from other major public health problems that we encounter, such as tuberculosis and malaria. And they've done this estimates using disability adjusted life years, or DALYs, which, as many of you know, is a common metric used by economists to evaluate and compare disease burdens across countries. Next slide, please. Oh, I'm sorry. And so a key question that we had is, these are very alarming statistics, and how good are these estimates and the underlying data that support them? And is it possible that these are either overestimates or even significant underestimates of disease burden? Next slide, please. And you can click all the way to the bottom, please. Thank you. So this backdrop is what led to our work with the World Bank on this topic. And our first objective was to determine whether or not there was even sufficient information to reliably quantify public health impacts from land-based pollution in low and middle income countries from these specific types of activities and industries that I mentioned. And if not, we felt it was very important to at least identify the primary knowledge and data gaps that were hindering our ability to make this determination And we also wanted to be able to provide some useful, timely, and practical recommendations for moving forward. Next slide, please. So we conducted a preliminary review of the literature. We reviewed over 60 different studies that have been conducted in low and middle income countries and teased out those that were specific to the types of activities and industries that I mentioned. And we published this work in the International Journal Risk Analysis, for those of you that might be interested in learning more about it. And the World Bank is also either has or is in the process of publishing a more detailed summary of this work as a World Bank report. And in a nutshell, what we found was that there are many useful studies that have been published in the literature and other sources of data that clearly demonstrate wide-scale environmental contamination and community exposures that are occurring from these different activities. But unfortunately, given many study limitations, it was not possible to generalize from or to aggregate these results in any meaningful way to quantify public health impacts at a broader level. And in particular, we were confronted with very different study objectives and different study designs that were used across the studies we evaluated, as well as the use of different sampling and analytical methods, and a number of other data gaps and study limitations. Next slide, please. And if you can click to the bottom. Thank you. So we ended up identifying a number of different data gaps, many of which are shown on this slide. And as we will discuss in the next part of our presentation, we believe that many of these gaps can be resolved by specific data collection efforts going forward. And so obviously we don't have time today to go through all of these, but briefly I'll mention that what we found was that many of the studies we reviewed relied only on a targeted or convenient sample, and sampling data were sometimes not collected in a random or systematic way across studies. And we also found that only a subset of relevant pollutants and exposure pathways were routinely being assessed in these studies. And little data were being collected on population-specific exposure factors, which would aid greatly in our understanding of how different segments of the population are being exposed to environmental pollutants such as mercury and lead. Additionally, we found that the traditional exposure and risk assessment approaches and models that are often used in other countries were being underutilized in these evaluations. And we found in particular that more could and should be done to help interpret and collect the use of more useful biomonitoring and health outcome data, particularly with an eye towards evaluating biomarkers of exposure and biomarkers of effect. And so as I mentioned, we go through some much more of these details in the publications that I mentioned if you want to learn more about them. Next slide, please. And one of the recommendations that came out of this work, which Dr. von Stackelberg will describe next, relates to the development of a systematic framework and uniform protocols for data collection and sampling in low and middle income countries. And we believe that by developing and using a more uniform approach, this will not only improve our ability to quantify and assess public health impacts from land-based pollution in low and middle income countries, but will also help with local capacity building efforts and provide necessary information to support risk management decisions at both the local and regional levels. And so with that, I will pass the presentation over to Dr. von Stackelberg to describe some more of our follow-up work at the World Bank. Thank you.
Thank you very much, Pamela, for the very good presentation. I would like to pass the floor to the next speaker. Essentially, is Dr. Catherine von Stackelberg. Just opening, sorry, and just connecting to the presentation. Sorry for that. It takes 2 seconds.
Thank you. And while he's doing that, I've actually placed in the chat the link to a report that I will be referring to that came out of this work. So if you go to the next slide, please. This reinforces a little bit of what Dr. Williams just said. Next slide, please. Yeah, thank you. This reinforces what Dr. Williams just said. There have been a number of papers that have actually looked at artisanals and small-scale gold mining. For example, this paper that focuses specifically on Ghana. And you'll note that it says, well, there's a wide variation in the types of communities and ecosystems. We have a lack of detailed exposure assessment information. We need to better understand site-specific conditions. And so while this article and several others like it have suggested or indicated that we do have some health impacts associated with these kinds of informal activities, we just don't have detailed information in order to be able to make those linkages in a way that better informs regulatory decision-making and decision-making in those countries. If you go to the next slide, please. Here's another paper that came out fairly recently that looks at some demographic factors and heavy metal concentrations across different individuals, some of whom are working and some of whom are not in the industry. And we do see differences in biomonitoring data across these kinds of populations, but papers like this don't actually necessarily address the exposure concentrations in the environment. So again, it's very challenging to make these kinds of linkages and really understand how these exposures and outcomes are related. So if you go to the next slide, please, we just saw this from Dr. Williams. In order to understand how localized activities are influencing health outcomes at the community level, we really need different layers of data, and can be fairly resource intensive. If we do a full epidemiologic study, for example, it takes a long time. The exposure information is typically not as refined as it needs to be. If we rely on risk assessment alone, we will have a better understanding of exposure typically because we use models and monitoring, but we don't link to actual health outcomes at the community level. So our thought was, how can we design a parsimonious protocol and framework for collecting data that will address all of these domains in a sufficient level of detail to allow, first of all, the kinds of calculations we need to ascribe or to assign health outcomes that we see in the community to particular sources, but also be able to compare across industries and across regions, and also, as mentioned previously, allow for that local capability. We want to empower local communities to develop the tools to do these kinds of analyses on their own. We don't want to have to bring in outside expertise and those kinds of things. So we have multiple goals here. And what we decided to do is, if you go to the next slide, please, this is the paper that came out of this work, and there are some individual documents focused on individual informal industry sectors, such as artisanal scale gold mining. This paper sort of summarizes protocol development and the process that we followed and the data sources that we used and all of those kinds of things across all three. And I've put the link into the chat for this particular paper, and I believe there are links as well in the chat for the individual protocol documents. So I just want to quickly walk through, if you go to the next slide, please. The goal was to develop a consistent format across these guidelines. So the 3 guidelines that we've published so far are for particular industry sectors, but the idea is they could very easily and rapidly be adapted to either other kinds of industry sectors or other applications entirely. And they're also designed in such a way that they're modular, so that if there was a need or an interest or a desire to focus on one particular aspect, for example, just biomonitoring data or building local capacity to do a more robust environmental sampling, if you needed to focus on any one of these, it's presented in a modular way with lots of references and backup information and detailed resources to turn to, so that one can put it all together, so to speak, to tell this entire story, or one can also kind of break it down and just look at the individual modules. If you go to the next slide, please. So we've already heard a little bit about ASGM, artisanal scale gold mining. It's can be up to 25% of global gold production. It's leading to significant and measurable amounts of mercury emissions globally. Some 37-38% of global mercury pollution is associated with these activities. And so we know communities are at risk. And another thing is that a number of papers that have been put out really focus on the miners themselves, as opposed to the community, because we're really interested in community health outcomes. Of course, the miners are important. Obviously, I'm not trying to suggest that, but we really want to know, what is the community burden experienced from these kinds of activities? And the other thing is that we noticed in our review that Dr. Williams presented is that a lot of times the exposure information will focus on just one area where the activities are occurring, or in some cases will not even capture the areas where activities are occurring, but will just use a maximum concentration and relate that to what we see in the community. That's actually not sufficient to be able to do the kind of analysis that the economists and others are looking for, right? Which is to really be able to not isolate per se, but to really make a clear connection between the exposures that we've measured in the environment and the health outcomes, not predicted health outcomes, but actual health outcomes that we're seeing in communities. Next slide, please. This comes out of another paper from the literature that really shows sort of the context, and we do have to always remember we're focused on a very particular aspect here, chemical exposures associated with these activities. But we have to take a step back and look at, why are these activities occurring? What is the motivation? What's the larger context? What are the ecosystem services? What are the drivers that are creating this situation? And so this paper, it's actually a set of papers, and Dr. Bazu's team up at McGill have done quite a lot of work in this area, really provide a good and interesting and the right kind of background if people are interested in seeing that. Next slide, please. So I think we're all familiar probably a little bit with artisanal scale gold mining. There can be wide variation and differences in the exact impacts that are experienced in communities depending on the exact kind of mining that is conducted, whether it's whole earth, whether there's open burning or not. There's a site-specific aspect to this that we recognize, that we generalize, and we talk generally about what artisanal scale gold mining looks like, but we can't be overly prescriptive because there will be differences across communities depending on the specific kinds of activities that are going on in a very specific way, exactly what is happening. In a general sense, though, if you go to the next slide, please, we always start with some kind of underground mining. There's some kind of pumping to get the ores and the materials out. And then we have typically done by hand. There will be crushing and extracting of the broader gold that we're looking for. There will be milling. These general steps are in common to all artisanal scale gold mining activities, but they will differ in their exact details depending on the specific kind of ore that's being used and where the milling is done. A lot of times these activities are done in different areas. So this is a general outline of what that process looks like. If you go to the next slide, please. This slide summarizes, and we won't go through in detail, the different exposure routes that are experienced at ASGM sites: inhalation, ingestion, and dermal contact, and they will differ. We have mercury vapor that is initially released, typically through the processes that we looked at in the previous slide, and that vapor is in a particular form and has impacts. But as we know, that vapor then can settle, particularly on water bodies directly or be carried into water bodies, which is then where we have methylation occurring, and that's where we get the organic form of the methylmercury that is additionally of concern and is known to bioaccumulate in food webs. So that all of those processes lead to these kinds of exposures, and so we can have direct inhalation of the vapor or particulate matter from the milling and the crushing that goes on. But then we also have ingestion, either incidental ingestion from those kind of particles, or because we've had transfer through the food web, fish the primary target, but also there's evidence for mercury accumulation in agricultural products as well. So we sort of cover all of those. If you go to the next slide, it shows a general conceptual model of mercury cycling through the environment where you have local contamination. And again, once we have mercury entering the aquatic system, that's where we really see that transformation through methylation processes into methylmercury and subsequent bioaccumulation in the food chain. If you go to the next slide, this is another little cartoon that depicts exactly what I'm talking about. It comes out of a paper that we referenced earlier. And the key exposure pathway of concern and the key environmental process of concern is really this transformation in the aquatic environment, leading to the potential for bioaccumulation. So if you go to the next slide, please, what we did in the protocol documents, and here's the example for ASGM, is we developed these generalized conceptual models that sort of cover all the different ways in which there are likely to be exposures to mercury, including the transformations, looking at each step of the process, which again, once we get into the site-specific version, these will be refined in different ways. But we provide this very general overview all the way out to the actual health outcomes that we're concerned about with these specific contaminants. Now, what the document does, if you go to the next slide, please, is it actually provides a process, a fairly detailed process, that goes through to make this general conceptual site model very site-specific. What kinds of questions do we need to ask? What do you need to understand in that site-specific context in order to understand what's happening at your site? The key, of course, is finding individuals, or identifying, I should say, individuals or households really, that are representative of the community. So we don't actually want necessarily to focus on mining families only, that kind of thing, right? We want to understand community exposures. So there's a detailed process described in these documents for how we identify participating households, because there really has to be this direct connection between the exposures, the biomonitoring data that we recommend collecting, if at all possible, and the health outcome data. Of course, the biomonitoring health outcome data come from the same individuals. And then the idea is that we want to sort of reconstruct their environmental exposures in order to tell this entire story. And so what the protocol document does, what the protocol documents do, if you go to the next slide, is actually provide a series of very specific questions that need to be asked in order to start that process of identifying the participating households and then going in and collecting actual data. Now, we don't specifically recommend exactly what kind of analysis is used, because there's lots of different ways to evaluate the resulting data. The focus is really on the data collection effort and ensuring that the data that is collected is comparable across different sites and studies and all of that. And we actually recommend establishing things like exposure factors, you know, in more developed countries such as the United States, for example. We have published exposure factor handbooks and a published exposure factor handbook that describes quantitatively the variables of incidental consumption and fish consumption and all those kinds of things. We don't have that kind of data in a lot of these resource constrained settings. And as we continue to do these kinds of studies, we certainly would like to be able to have those data more widely available so that others can use them. If we go to the next slide, the next key aspect is determining the zone of influence. And of course, we have to link back to the specific objectives here. In our case, we assume that the primary objective is to link environmental sampling and biomonitoring data with community health outcomes. But again, in a localized setting, it might be just looking at biomonitoring data or just looking at site characterization. So we have, again, a detailed set of steps to go through that help people to characterize the environmental setting, identify the general demographics, and of course, everything links back to that site conceptual model and sets the stage for collecting the field data. If we go to the next slide, please. Just to reinforce that again, identifying participating households is really, really important. And we are not, again, can't be overly prescriptive on sample sizes and power calculations, which will depend on the specific hypotheses. And again, we have multiple contaminants, multiple exposure pathways and health outcomes. And it's very challenging to satisfy all objectives in one study. But we go through a detailed checklist and set of questions to figure that out. And in general, we recommend somewhere between 200 and 300 households as a working sort of straw man. So then we go through a process of how you overlay the grid on the site map, make some recommendations about grid density. We talk about targeted sampling as opposed to just having the random sampling in order to identify potentially vulnerable populations like schools and things like that. Which sets the stage for the household survey. If you go to the next slide, please. The household survey is really important, first of all, because it establishes that communication with the population. It enables and encourages stakeholder engagement. It allows for people to and researchers to get in the field and actually talk with the communities that are impacted. And it's an enormously important source of information, including behavior and time activity patterns, self-reported health outcomes. And again, we have quite a detailed list, including sample household surveys that we recommend using, and again, sets the stage for the detailed environmental sampling, as well as allows for refinement and in that conceptual site model. If you go to the next slide, we provide fairly detailed recommendations for media and contaminant specific environmental sampling. We emphasize the use of in-field methods that will allow rapid data and also are less expensive, but combined with confirmatory samples that can be sent to a laboratory, ideally a local laboratory, so that we get that more refined data and actually, we're sure about detection levels and things like that, that we're getting the data at the level that we really need. If you go to the next slide, please. We go through a detailed list of biomonitoring data, the kind of biomonitoring data that should be collected, and we disaggregate it into the gold standard, pretty good, but not the gold standard, and then methods that you should actually be avoiding for biomonitoring data. And here's the recommendations for the gold standard for the contaminants likely to be encountered in artisanal scale gold mining. If you go to the next slide, please. The kinds of health outcomes that are associated with the contaminants here include, of course, developmental outcomes related to mercury and methylmercury. Lead is also associated with developmental health outcomes in children, but also cardiovascular and renal. And for arsenic, we see in acute cases, there can be skin rashes and hyperkeratosis, lung cancer and bladder cancer, so carcinogenic outcomes in adults, and also developmental and cognitive deficits in children, but it's of a somewhat different nature than with lead and mercury. Next slide, please. So again, we go through a hierarchy, if you will, of health outcomes and ways in which to measure those health outcomes to, again, allow for the least invasive but most robust and targeted biomarkers that will allow us to really understand whether these exposures, whether these outcomes are associated with the exposures that we're really concerned about. So we spend a lot of time talking about how you want a biomarker that's relatively unique to that constituent, and so we go through that discussion. There is a hierarchy of health outcomes ranging from a formal diagnosis or medical diagnosis to clinical testing, to different kinds of biomarkers that may indicate an intermediate step in the progression to actual frank disease. And so we talk about those in the document. The next slide provides the contaminant-specific recommendations for each of the contaminants that we're concerned about. including cognitive testing. There's a long discussion in the protocol documents about cognitive testing and being culturally sensitive and adapting those to particular areas and references and sources for that. Again, we want to emphasize in-field and point-of-care methods where we can. So for mercury itself, for example, we do recommend doing a quick toenail in-field XRF, potentially also combined with hair in order to establish that relationship so that going forward we can actually use more of the in-field XRF kinds of methods. Next slide, please. So in conclusion, we developed these guidelines for a particular specific objective, which is at the broadest level, understanding potential health outcomes at the community level as a function of specific land-based pollution sources. A, to tell that story, B, to provide regulators and others with the tools to be able to target potentially those specific land-based pollution sources. Without the data and without the connection, it's difficult to justify potentially actions that are taken to reduce those exposures. And we're looking to maximize the likelihood of discerning the signal from the noise. Lots going on here, right? Not just these exposures. There's access to healthcare. There are all kinds of things that influence these health outcomes. And we're really trying to allow for the highest probability that we're going to be able to make that connection to the particular activity that we're interested in. At the same time, though, we're sensitive to the need for achieving multiple and varying sub-objectives. You may just really want to look at biomonitoring data. And speaking of which, again, we do recommend that there be, as there are in many developed countries now, central repositories for these kinds of measurements. Also, don't advocate doing these as one-offs or this study. The whole idea is to be able to compare across places and outcomes and communities. And in order to be able to do that effectively, we need a mechanism for collecting that data more broadly. It's important to think through those power and sample size calculations. We don't address in the guidelines statistical methods and analyses. A lot of this depends on the downstream users, and a lot of it will also require integration with economic kinds of data. And so there has to be communication, cross-disciplinary communication across everyone in the field. So if we go to the last slide, and this is the last slide, we do recommend that there should be a plan or a consensus on anonymized data repositories, similar to the kinds of things that we see on the left-hand side of the slide here, the Gather and Equator Network and places like that. That would allow for things like developing exposure factor handbook and things, for future analyses, so we don't have to collect data every single time. This is a great way to elicit community preferences. And having this consistent data collection will really improve our understanding and implications of land-based pollution, and in this case, specifically in the context of artisanal scale gold mining. And again, it's really important to remember that larger picture of what are the drivers of these kinds of activities, and how can we close the loop there? How can we make it possible? It's an economic decision on the part of communities to engage in these kinds of activities. So how can we help close that gap? And ecosystem services and things like that, looking at the environmental outcomes, not just the health outcomes, may help in that regard as well. So I want to thank you so much for your time, and I'd like to open it up or turn it back to our moderator for questions and discussion and all of those things. So thank you very much.
Thank you very much, Dr. von Stackelberg. So now we will move into the last presenter for today, Mr. Eric Negulich. Eric is an ASGM expert. He works in UNITAR. Just give me a few seconds to upload the presentation, and then we are all set. Just a second.
Hey, while Jorge gets that up, I'll just say a quick thank you to the previous two presenters, Dr. Williams and von Stackelberg. Those are great overviews of some of the health impacts and your approaches to monitoring, measuring those. And hopefully this presentation will tie in well. Well, the previous two presenters focused on frameworks and assessing health impacts. I'm going to step back a bit and look at a higher level, looking at collecting baseline estimates of mercury use more broadly at the local, regional, and national scale, and the importance of field data in producing those estimates. So Jorge, could you please move to the next slide? So what we'll quickly do here is I'll give an overview of a common baseline approach that is being promoted for use in all the national action plans under Minamata for ASGM use. And then I'll touch on an example of collecting field data and tying these inventory estimates into field data. As we heard in both of the previous two presentations, mercury use in artisanal and small-scale gold mining is widespread, and it's highly variable. So understanding the variation in the sector within and between countries is key. Next slide, please, Jorge. Could you move to the next one there, if you have a chance, Jorge?
I'm sorry, just...
Yep, no problem.
Okay, sorry.
Okay.
Now it's moving. Okay.
You got it. Thanks. Okay, so this slide here, there's already been a lot of really good work done on producing approaches to these estimates. There's a guidance document that the Artisanal Gold Council and UN Environment produced a few years ago on estimating baseline ASGM mercury emissions, which is really good. There's a lot of tools and resources that go with that, as well as the guidance document to developing national action plans that UN Environment produced, which shows how these baseline estimates fit into informing reduction targets and approaches. So the overall approach is first to look at what's out there already. So there's not a lot of information in some areas of countries, but typically all ASGM countries have some information. So start with baseline scoping, understand the sector by looking at literature and stakeholder interviews to figure out what's there and where the gaps are. From there, we look at developing inventory approaches to fill those gaps, and we come up with some field plans to get out into the field to collect the data that we need to improve those estimates. You then go out and collect, compile, and analyze that data. And wherever possible, and I think this is key, we try and cross-check and triangulate estimates by producing them from different sources of information to help improve our confidence in the estimates. And with that information, we then arrive at local, regional, and national level mercury emission estimates. Next slide, please. So when we look at ASGM baseline information, we're looking at mercury use, of course, under Minamata, that's the key. But along with that, we also look at gold production and workforce, because both of those give us some information on mercury use. To do this, again, we look at the local scale, so site-specific. We look at the regional scale, so which regions have the highest emissions and which practices are used where, to then come up with national estimates of mercury use and gold production for the sectors. Next slide, please. So the approaches that we typically use to producing these estimates there's three areas that we look. The first is the extraction sites. So those are the mines. By getting an understanding of how many mines and the production from these mines, both as far as ore output and the gold produced from the mine, it gives us a sense of what's being produced. And then if we understand how it's processed, we can come up with estimates of mercury used based on the amount of extraction from mines. The second and most obvious one is, of course, to look at the processing system. So where is the gold processed and how much mercury is being used from the different types of processing systems to produce that gold? And then the final cross-check that we can use is looking at the earnings. So if we understand how much miners and processors and owners are earning, and then how they share the revenues from the gold produced, we can then use that to come up with an estimate of the total gold produced as well. And then, of course, if we understand how that gold was produced, we can apply a ratio of the mercury used to produce that gold to come up with mercury estimates. So these are three different approaches that we try and use, and ideally you can use all three to help cross-check and hopefully come up with similar results. It helps us reduce error. Next slide, please. So collecting data in the field, there's three main ways that we do this. The first, of course, is speaking to the miners and the processors and the stakeholders in the sector. Interviews are great. They provide information that you can't get from observations and physical measurements, things like how many days are the sites active per year, which seasons are they not active, that sort of thing. So really good to get out there and do interviews. Observations are also key. So going to these sites and counting how many processing systems are active, counting how many bags of ore are being produced in a period of time, that sort of observation really helps because it ground truths it. And then finally, physical measurements are key. So particularly when we're looking at mercury emissions, it's really hard to get from interviews the actual amount of mercury used. So if you can get to a site and sit on the processing system and measure the amount of mercury that's being used, as well as the gold produced, that's really the truest source of information and what we aim to do. Next slide, please. So when we look at field data collection, I'll now turn to a quick example. We're working with Nicaragua to produce a baseline estimate there right now. So we'll go over some of the work that we're doing with them and tie it to the field to give an example of how we do this. So on the left, there's a map of Nicaragua with 4 sort of general mining regions highlighted. In the top right, you'll see there's a bunch of dots, and in there, these aren't actually where they're located, but it's just to represent that within each area, there's a series of different types of processing systems present. One of those you'll see on the right is called a rastra. And they're kind of everywhere in Nicaragua, and it's essentially a giant mill. So what you see here is there's 2 rocks that are being dragged around in a circle over this concrete bowl with a rock base. The ore is added in, water is added in, and mercury is added in. And then the big rocks crush the ore down to a fine sand, liberates the gold, which then bonds with them and amalgamates with the mercury and settles to the bottom for later recovery. So it's a whole ore practice. There's a lot of mercury that's lost into the tailings and into the water. So it's a worst practice that we're hoping to improve. But before you can improve it, we need to understand what the emissions are, how many of these systems are, and how they work. So if you can move to the next slide, Jorge. So to collect field data, what we want to do is measure the total mercury added and the total gold recovered. Our approach to doing this is to actually go to the sites and sit there for an entire processing workflow to measure that mercury and that gold produced. It takes time, and actually, Jorge, could you just move to the next slide, please? And I've done this once myself previously when I was working with the Artisanal Gold Council, and thanks to them for these photos. And we're doing it again now. We've been training the Nicaraguan team to take these measurements. So there's 3 things we want them to measure. The first being ore throughput from the systems and the grade, then of course mercury use on these systems, and then finally the total amount of gold. So for ore, what you can do is you can sit there and you can measure every time ore is added to the system. You take a measurement of the amount of ore, the weight of the ore added, or you can measure the ore bags and figure out how much they weigh and then how many bags are added per processing workflow. You want to measure the mercury added and the mercury recovered. So every time mercury is added, you take a measurement of the weight of mercury that's added into the rastra. And then at the end of the processing workflow, you measure the total amount that's recovered. This gives you the difference in the total amount of mercury that's lost. And then, of course, we want to know the gold production. So at the end of the process, once they've formed their amalgam and burned off the mercury, you can then weigh the sponge gold to come up with an estimate, or a direct measurement, rather, of the total amount of gold produced. And ideally, we would then correct this for the purity of the gold, which you could find out from either local gold shops or potentially even there's a known general purity for the area. Next slide, please, Jorge. So with this information, you can calculate some basic things. You can calculate the daily throughput of one of the rasters. It's the total number of ore bags times the weight. You can come up with the mercury loss by taking what's been added and subtracting what's been recovered. You can then come up with the total gold produced by weighing that gold and correcting for its purity. And you can come up with the ore grade on average based on the throughput divided by the total gold recovered. And what this then allows us to do is to develop what we call the mercury to gold ratio, which is for every unit of gold produced, how much mercury is lost. You simply divide mercury lost by the gold to get this mercury to gold ratio. So Jorge, if you could go to the next slide, please. So then looking at this, we've now produced some key information from one site, which is great. And it's a baseline for that site, but we want us to understand this at a regional and a national level as well. So if we can do these measurements at multiple sites, maybe 5 or 10 rasters, and then take the average of the gold produced and the mercury used from those, come up with an average mercury to gold ratio, and then apply this to the total number of active rasters in the region and how many days active per year, then we can come up with a regional estimate of mercury use. So this is key because it allows us to focus at the local level, but also to extrapolate more broadly to regional levels and identify those areas where we have worst practices, which is key because then we can go in and do technical interventions to reduce mercury usage or do health studies like the ones we had heard a little bit in the last 2 presentations to improve our information. So next slide, please, Jorge. So in summary, the key here is the field data. It really is the truth of the sector. So we need to get out into the field to collect these data to produce our estimates. Standardizing this can be difficult because we know that the sector is so variable, but if we take standard tools, approaches, information requirements, and templates to this work, we can produce some consistency. And finally, once we have these baseline estimates and we have an understanding of the sector and the variation of the sector within a country, we can then focus on those areas that we want to do further work. It could be detailed health studies, it could be technical interventions, it could be anything. But these baseline estimates are the first pass that really do let us know where the issues in the sector are and where we can do further work. So I'll stop there. I think we've got a few minutes for questions, and thank you all for joining.
Thank you very much, Eric, for your presentation. Well, now we have still 10 more minutes. We move quickly into the next session, which is discussions and questions and answers. And for that, I will see on the chat if you have some questions on the chat. Or if not, if any of the attendees would like to raise your hands, so you have any questions. I don't see. I see that. I see anyone? No? Catherine, do you see any questions on the chat? I don't see it. Okay. Okay. Here it is. This is from Monica Cunha to all panelists. How can I join the group working on this? Okay, she's a chemist, industrial chemist. And then she is working in Central America. I don't know if there is a group on that, particularly there's no a group UNITAR and World Bank, but I know that the Minamata Secretariat has different groups working on mercury. So then probably that would be the first step. And actually, she's actually saying that she would like to contribute to those efforts. Thank you very much for that. And then if you want to join Monica, I think we will get her email address. Yes, William. Sorry, Pamela.
I would just add, I'm not sure which group that question, the person that asked that question came from, but we are definitely interested in people that are working in communities or with governments that could start to implement, for example, some of the protocols that we have just recently published. And I'm sure some folks at the World Bank could probably put them in contact with to sort of help different groups maybe start to implement these protocols and start to collect the kind of data that we think needs to be collected. Thank you.
Thank you very much for the answer. I think most of the questions is to share the presentations, which actually we will share the presentations. And there's also one question on having access to the video, which actually this side event is recorded, so you will have access to that as well, just as general information to everyone.
And Jorge, we have one question in the Q&A box from Machi Pisa. Can you read that as well? And then we have two people that raised their hands to ask questions.
Yeah, let me see, because I don't see that. Okay, I have. Okay, so I'm gonna give the floor to the first person who's raising the hand is Bahira Palipan.
Go ahead, Bahira. You're unmuted, I think. Yeah. Bahira? Okay.
I don't see.
Unmute.
Okay. Now it's
Bahira, can
yes.
you speak up, please?
Can you hear me? I'm Vajra from Sri Lanka.
Yes, we can hear you.
Hi, thank you. Hi, I'm a consultant occupational physician in Sri Lanka working for the Department of Labor. And I see this as a more occupational problem because as far as I have been in the field of occupational and environmental medicine for last 25 years. And as we see these informal sector mining in the South American continent and African continent, it is their contribution to their respective economies is enormous. Therefore, what I feel is to regularize this informal sector into formal sector by introducing technology and empowering these workers with technical know-how, how to work safely, and empower the respective countries, their governments, and their governing their enforcement bodies in environmental and occupational health to protect these workers. Because even in my own country, Sri Lanka, we are a country in transition economy. The informal sector is the most important contributor to the GDP. Therefore, we need this informal sector. So what I personally recommend is to convert this informal sector into formal sector by, we need a lot of work to do that, but I am sure that the funding agencies like World Bank definitely can step up and take this initiative to, one thing is they need technology. You have to uplift and upgrade the current primitive technology that these countries use in gold mining. Other one is to equip the workers with technical know-how, how to work safely. So those are my concerns as an occupational physician, and I also work for the United Nations Environmental Program in their technical working group in chemical safety. I'm sure Oliver also in this group. I work with Oliver from UNITAR also. So this what I have been advocating as an occupational environmental physician. Thank you very much.
Okay, good. Any of the panelists would like to answer to Mr. Wahira? Yes.
I would just quickly add, I do a lot of work in the occupational arena. I totally agree with that. It's not as much the emphasis, the worker population for our protocols. We focus very much on community exposures and risks, particularly among women and children, given some of the endpoints we're looking at. I think it would be great to try to integrate and couple the community and occupational exposure, since many of these activities are occurring in more home environments, not just at a central workplace. And there needs to be better integration of that. We don't do a very good job in the developed countries. We're very siloed in our approach between the occupational and community exposures and risk profiles. And I think this would be a good opportunity internationally to try to integrate some sort of, from a risk management policy perspective, making sure we're not just covering the workers, but we're covering community members as well, particularly for these types of activities. Thank you.
Thank you. I would like then to pass the floor for a second question to Mareike Kroll. Sorry.
Thank you very much. Can you hear me?
Yes, we can hear you.
Okay, perfect. Thank you so much for giving me the opportunity to talk briefly. I'm working for the Artisanal Gold Council, and I would like to also comment on the comment by the previous speaker. We work on formalizing the artisanal gold mining sector in various countries. However, I'm mainly working on the health component of our work, and we, for example, been supporting countries in developing national action plans, including public health strategies, and also providing training for healthcare providers who often have almost no pre-existing knowledge on mercury intoxication, whether it's caused by the methylmercury exposure or methylmercury exposure. Therefore, I really appreciate the approach to come up with a standardized methodology. I think it's extremely important because what we see also at the level of the Ministry of Health is often a lack of capacity and a lack of understanding, which leads to poor study designs. I absolutely agree with the key findings presented here from the panelists. For example, what we see sometimes is also measuring elemental mercury in hair, which is not the right specimen. So I think the standardized methodology is a great step, and I would like to get in touch and learn also more about it. I'm just wondering, in terms of HBM and environmental biota, what I feel is that there's actually more capacity required in order to really come up with the best approach in resource scarce settings. For example, elemental mercury in soils is very inert. It's very difficult if we do not know where elemental mercury has been released. Just grabbing samples is not going to provide us with adequate data. And our concern is really that a lot of resources are kind of directed into the wrong direction due to poor study designs. Another aspect is also lack of international exposure thresholds, which is obviously a very difficult aspect from a political and a medical. However, for example, in the US, there is a lot of different exposure thresholds which have been defined for occupational settings as well as the general population. And I think there's a lot that can be learned for countries with an ASGM sector, which would be really great to include into that guidance to just help governments in countries with ASGM sector to provide evidence for evidence-based decision-making. Thank you. And maybe also as a question, were there any attempts to include this kind of additional guidance into the guidance documents you're already developing? Thank you.
Thank you. Anyone would like to? Yes, Catherine.
I can just very quick, I know we're running out of time, so I'll just very quickly answer that yes, we go through a fairly detailed discussion of elemental versus methylmercury and what is the importance in tracking it back. So we do, as much as we can, sort of really do address that. With respect to threshold levels and, for example, the reference doses that are used in the states and those kind of things, we actually stay away from that just because the focus here is to enable local communities and researchers to collect data in a consistent way that links these health outcomes to these exposures versus looking at thresholds and those kinds of things. That is an interesting question. That is another question, but not exactly the focus of these documents, but it is absolutely important. And there are lots of resources on those kinds of levels from WHO, US EPA, other environmental agencies around the world. Thank you.
Thank you very much. And having just, I think we have only 2 more minutes to wrap up and to have some concluding remarks. And I would like to invite Solvita, if you can please help us with the concluding remarks.
Yes, thank you so much. Yeah, this was really rich content of the discussions. And also, you know, I noted the questions that were asked by Mr. Wahida and Ms. Kroll. So they are obviously very, very relevant. And I see that this work that was presented today is just one of these significant steps that tries to address the data problem that we face so very often while addressing the chemicals management. And I think this is the data problem is this is the key basis that could provide us all information, not on the public and the decision makers, that would put the chemicals seriousness of the chemical pollution into the broader agenda, compared like as if we would compare it with other environmental challenges. And it's really been very, very dense content of and very highly technical content of this presentation. I really want to commend all 3 of our speakers that they were able to put it in such a short and clear format. And I can see that hosts have also shared the links on the reports. I think that there will be, I can see from the chat that many of the participants would be interested to learn a bit more and more details about this initial work. And then finally, I would really like to thank our partners in Minamata Secretariat and UNITAR that made this presentation possible, and we look forward to working with you all together. Thank you so much.
Well, thank you very much to everyone, to the presenters, Catherine, Eric, Pamela, Solvita, and to the Minamata Secretariat for giving us the space and helping us organize this. Thank you to all of you, the participants, for your time and for your nice questions. So we'll keep in touch, and please send us more questions if you have. We will send you our emails, our addresses, and then please contact us. Thank you. Thank you.